Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Stroke. What you should know. Introduction. You could save your life or the life of a loved one by learning the symptoms of a stroke and acting fast when they happen. This program will help you know more about strokes, including warning signs. It discusses risk factors, medication, and following up with your physician. F.A.S.T. Warning signs of a stroke. Use the F.A.S.T method to recognize and respond to stroke symptoms. F stands for face. Ask the person to smile. A stroke may cause a smile that is uneven or a droopy face. Call 911 immediately if you notice these symptoms. A stands for arm. Ask the person to raise both arms. A stroke may cause one arm to drift down. Sometimes the person cannot raise one of their arms. Call 911 immediately if you notice these symptoms. S stands for speech. Ask the person to say a simple phrase. A stroke may cause a person's speech to be slurred. The person also may not be able to respond. Call 911 immediately if you notice these symptoms. T stands for time. Every minute counts during a stroke. Call 911 immediately and get to the hospital. Risk factors. The risk factors for stroke are different for each person and may include high blood pressure, obesity, high cholesterol, heart problems, diabetes, smoking, inactive lifestyle. Other risk factors may include previous stroke, previous or current TIA, heart disease, carotid artery disease, drinking too much alcohol, certain disorders that affect the blood. Your healthcare provider can give you information about how to manage these risk factors. Some risk factors may even be eliminated, such as smoking and drinking too much alcohol.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Taking medication. Your healthcare provider may prescribe medications to help reduce your risk of stroke. Medications can help you manage high blood pressure, cholesterol levels, diabetes, heart problems, clotting disorders. Some medications should not be taken with other over-the-counter drugs, supplements, and herbal remedies. Check with your healthcare provider before taking any supplements or medicines. Medications are an important part of treatment after a stroke. Make sure you talk to your pharmacist or healthcare provider about the correct way to take your medication. Most medications need to be taken every day even when you are feeling fine. Make sure you take all your medications. Having a routine may help. For example, you may be able to take your medication at breakfast time every day. It may also help to keep a pill box that has days of the week compartments. Never stop taking medication or change your dosage without first talking to your healthcare provider. Also, tell your healthcare provider about any side effects you experience while taking your medications. Dial, don't drive. If you have already experienced a stroke or a TIA, you are at risk for having another one. Make sure you are able to recognize the signs of a stroke. Know the F.A.S.T method. Call 911 if you think you may be having a stroke. Never drive yourself to a hospital if you think you are having a stroke. If you can't call 911, have someone else call or drive you to the nearest hospital. Permanent plan. Physician follow-up after discharge. Life after a stroke includes frequent follow-up visits with your healthcare provider. Your healthcare provider will help you make a permanent treatment plan. Talk to your healthcare provider if you have trouble following the plan. Sometimes people face hurdles such as the cost of medications and depression that make it hard to stick to the plan. Remember, your healthcare provider wants to help you. He or she can help work out a solution with you.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. You could save your life or the life of a loved one by learning the symptoms of a stroke and acting fast when they happen. FAST stands for face, arm, speech, and time. This is an important method to recognize and respond to stroke symptoms. The risk factors for stroke are different for each person. Talk to your healthcare provider about your stroke risk and ways you can reduce your risk. Also, talk to your pharmacist or healthcare provider about the correct way to take your medication. If you think you are having a stroke, dial 911 immediately. Never drive yourself. If you can't call 911, then have someone else call or take you to the nearest hospital. Thank you for using Explain.